Thank you, Mr. Speaker, and thank you, Representative Oliverson. I don't have the report in front of me, but I assume that you have looked at the report, the last report submitted by this program as to what their outcomes are, have you not?
I don't have it in front of me either,
Right.
Representative. I apologize.
But I mean, you just laid out all the things that you thought
Yeah.
it had done.
Yes.
I appreciate the efforts to do anything to help moms and babies and families, absolutely. And I think there's a variety of ways that we could support that in our budget. The concern I have about this is that we haven't, I think, done enough to provide the actual programs that are delivering the kind of services that could really do a lot more to help our families be successful. Many of the outcomes are based on handing out pamphlets. They're not getting the referrals made to the appropriate support services because, as you know, Thriving Texas Families does not provide health care. They only do the other support kind of services. And so we've talked about including other specific things, other specific programs in this strategy so that we could actually beef up some of those other programs that are really delivering a more robust services, such as the Nurse Family Partnership, and also had some information we considered in appropriations in our subcommittee on creating a program for parents in recovery so that we could keep moms and babies together. The mom can actually recover because, as you also probably know, do you not, that one of the leading causes of death of moms here in Texas is substance abuse?
I am aware that substance abuse contributes to maternal morbidity and mortality.
So what I would ask you is, when you're looking at putting more money into this, can we look at actually what programs might actually be delivered that have real outcomes that are going to help Texas families, as opposed to, you know, listing a bunch of pamphlets that have been given out and maybe a class that's been given? Can we look at expanding this so that we actually know that we're giving this money to programs that are really delivering services that are going to help Texas families thrive? Can we talk some more about that?
So, Representative, I'm always willing to visit about, and obviously I like to have more services rather than less. What I know about this program is that there's been 2.8 million clients served, over 150,000 patients. It is highly successful. One of the reasons we're increasing funding to this program is because essentially it keeps using all the resources we appropriate because of the great need. And so while I agree with you in the standpoint of I do think that maternal mortality and morbidity is something that we should be focused on, and I have in the past and will continue to work with you on a variety of fronts to try to address that. The purpose of this amendment here is to increase funding specifically for a program that's been proven to be highly successful and provides, to my understanding, a wide variety of services to support pregnant women and their families.
And again, I know you told me you don't have the report in front of you, but did you not just read me some statistics about some of the numbers that have been served?
Some, yes.
Yeah, and do you have information about what those services are that were provided in that?
Well, I read you a list of the services that I'm aware of that Thriving Texas Families provides.
Okay. I really want to work with you on this. I think that there are many things that we could do to help families and parents and their babies and their children. I want to make sure it's real services. And unfortunately, the report that I've read doesn't show that that's actually the case. So I would hope that we could expand this. If you're going to put more money in it, I hope you will consider making sure that that money is spent on programs that are actually going to be delivering services that will support these families. So thank you.
Thank you, Representative.